pulmonary embolism at the age of 33, which is pretty young.
When I first heard about people developing these sorts of clots, I immediately wondered, was this sort of a late stage of illness that we sometimes see in all sorts of patients that just have advanced disease and their clotting systems aren't working properly? What do you think is going on here, doctor?
In some patients, it can be the first symptom or among the first symptoms when a patient is ambulatory and pretty well, not at the end of life from some advanced heart failure or trauma.
Why this happens is one of the big puzzles facing doctors right now, and so is how to treat it. According to Dr. Buskis, the low doses of blood thinners they usually give to ICU patients to prevent clotting just isn't enough for patients like Warnell. A potential solution?
Giving those to patients in the ICU as a higher prophylactic dose. We're on a razor's edge between bleeding and clotting. We try to thread the needle for each individual patient.
How worried were you about this COVID disease before all this happened to you?
I know having to go to work, being at work, and just being outside in general, there was a chance that I could get it. I wasn't like 100% concerned, but I knew that it could have been a chance.
After more than a week in the hospital, Warnell is now a COVID survivor.
The moment I entered the hospital, I was in pain, shocked, didn't know what was going to happen, but as each day went by, I got a little bit better, and then I was happy to go home. I'm able to breathe. I'm feeling great.
Good for him. We're so happy that that story has a happy ending. But Sanjay, what's the connection? Is there some sort of underlying thrombosis issue with these patients, or an infection, or what?
Yeah, there seems to be, Allison. And again, the situation often is patients who have, they have this pulmonary infection. They feel like they're not feeling well, but they're otherwise doing okay. And then they have the sudden decline. And usually a sudden decline means that in this case, a blood clot was thrown into their lungs and they developed a pulmonary embolism. Could be that the virus itself affects the way that the body is clotting blood, and therefore they're more likely to clot. It could be that the virus is in the bloodstream and it's sort of damaging the lining of the blood vessel. That's causing clots. They're not sure yet. Could be a combination of both. But it does seem to be something that's happening and could explain, again, these sudden declines.
And do we know how often patients are suffering from these blood clots?
Yeah, we're 4 months into this, so this is all still early data, but there was a study out of the Netherlands that showed when they went back and looked for clotting, they found it about a third of the time in patients who had COVID. And then there were some other studies. There was a study just published in Radiology showing that about a quarter of the time patients were developing clots that were significant enough to at least cause even minor pulmonary emboli, maybe not as significant, one that was catastrophic like Mr. Vega's, but pulmonary emboli that they found in the lungs. Then there have been some autopsy studies where they go back and look then at the lungs of these patients, and they see the evidence of the viral damage, but then they find these clots as well. So it's something that they're finding more and more. I think one of the things that was, also concerning, Allison, in New York at Mount Sinai, same hospital, they have several patients all under the age of 50 who had strokes as well. And they think it's the same phenomenon. It's these clots. In Warnell's case, it went to the lungs, but in those patients at Sinai, it was going and causing a stroke in the brain. So they got to figure this out. It may be, putting patients on blood thinners when they come into the hospital that are more powerful than the typical blood thinners. But again, we're early days, Allison. We're learning this real time just over the past couple of weeks.
Yes, I mean, the learning curve for you doctors is so steep with this, but it does seem that every day you do make new discoveries. Sanjay, thank you very much. We appreciate that story. John.